Hi, everyone. Welcome back to Staying Compliant with KW Advanced Consultant. My name is Keisha Wilson. I'm the founder of KW Advanced Consultant. So I'm so glad you all are back here today again. In the last YouTube video, we discussed about if it's not documented, it wasn't done, right? And so the next few weeks, as I mentioned, we're going to be going over different elements of the evaluation and management services. But before we even begin reviewing a note, we open the record, we look at demographic information, but we look to see, is this a new or established patient? And oftentimes, believe it or not, you think this is easy, but coders, auditors, sometimes they have a hard time really understanding, is this a new and established patient? What are the criteria? Was this physician in the same group? Do they have the same specialty? Is it going to be like a new patient code, the 99202 through 99205? Or am I looking at the established patient section, the 99211 through 99215 for the outpatient office visits? So I'm going to share my screen. Let's take a look. I pulled up the CPT guidelines. And this is something when I educate clinicians on, I like to go over this part so that they understand, because sometimes a lot of the errors and findings we see may start from the physician side. And then as well as when I teach new coders, sometimes they have a hard time understanding this section. So we really dive into it and understand it. So let's go over it together, okay? A new patient, an established patient visit. Remember, you'll find this in your CPT book. It's right in the front before the evaluation and management guidelines. So you always want to go through this. Again, if you don't remember it, you know where to find it. I always say tab that section in your CPT book. So a new and established patient, solely for the purposes of distinguishing between a new and established patient, professional services. So remember, these are the physician services, and this is what we build on the 1500 claim form, right? So just the professional services we're talking about today and not the facility side, completely different. So the professional services are those face-to-face rendered by physicians and other qualified healthcare professionals who may report evaluation and management services. Remember, other qualified healthcare professionals can be nurse practitioners, can be PAs, midwives, that whole criteria of patients can fall, clinicians can fall within that category. Let's look at the highlighted section. A new patient is one who has not received any professional services from the physician or other qualified healthcare professional or another physician or other qualified healthcare professional of the exact same specialty and subspecialty who belong to the same group practice within the past 3 years. 3 years, very important. You want to highlight that section. So let's go over an established patient first, and then I'll explain. An established patient is one who has received professional services from the physician or qualified healthcare professional or another physician or qualified healthcare professional of the exact same specialty and subspecialty who belongs to the same group practice within the past 3 years. And then you also want to see the decision tree regarding new and established patients. So let's make it a little simple. Dr. Wilson, I'm an endocrinologist in a group practice with 4 other endocrinologists of the same specialty. I saw my patient. So my patient last saw me in 2023, but at the end of 2023, I left the practice and I have moved on. Dr. Clark is now seeing the patient today, February 15th, right? The day after Valentine's Day, February 15th. And remember, Dr. Wilson is no longer there. So although this is the first time the patient is seeing Dr. Clark, because Dr. Clark was in the same group practice as Dr. Wilson, is also an endocrinologist within the same specialty, this patient is now going to be considered an established patient because 1, same group, same specialty. 2, the patient was just seen by Dr. Wilson in 2023. So the patient was not seen past 3 years, right? They were seen within the 3 years, within the last 3 years. And actually, they were seen last year. So this would be considered an established patient. And oftentimes the physicians get confused because they're like, okay, well, they saw my colleague, but this is the first time they're seeing me. So this is going to be a new patient code, and I'm going to code it between using 99202 through 99205. But that's incorrect because it should be an established patient using the codes 99211 through 99215. So we want to keep that in mind. So before we even begin to code and all that stuff, of course, we got to look through the documentation, but we also want to see when was the last time this patient saw with anyone within this group practice, and were they the same specialty and even same subspecialties. So subspecialties are important. Oftentimes, some specialties may have subspecialties, and that will distinguish whether this is a new or established patient. Cardiology, for example, is one specialty that has a lot of subspecialties within them. So you definitely want to understand the subspecialties. You want to check your payer policies because some payers may not honor subspecialties and they're looking at whether this is the same specialty or not. So you also want to understand that as well when you're reporting the codes. Also keep in mind, if the physician is not there and another qualified healthcare professional is covering for the physician, whatever that visit was supposed to be, that's exactly what that visit is going to be. So if Dr. Wilson is out, but the NP or PA are now covering for that physician or the midwife, and that visit was supposed to be a new patient visit, well, this is going to be a new patient visit, just built on the different circumstances. And we're not talking about split share or incident two today, but different circumstances, right? So it's going to stay the same. If it's supposed to be an established patient visit, it's going to be an established patient visit. So that's where credentialing also comes into play and is very important when it comes to the new and established patient visits. The decision tree also, it's down here. It's also another good tool that you can look at when it comes to new and established patients. So let's go over it together. It says, a new versus established patients received any professional services from the physician or qualified healthcare professional or another physician or other qualified healthcare professional in the same group or same specialty within the past 3 years. Yes or no? If it's no, then you know it's a new patient. They were never here before. No medical records exist, nothing. New patient. Easy, right? We wish all our cases was like that. But sometimes we have to become investigators, right? So now we're looking at, yes, some more questions. Are they of the exact same specialty? Yes or no? If it's no, then okay, it's a new patient. Easy, right? But what if you answered yes? Is it the exact same subspecialty? Yes or no? If it's yes, then it's an established patient. If it's no, then that's a new patient. So sometimes it may be a lot you may not always remember, but it's important to understand where to find the information in your CPT book. And you always just want to go over it so you're clear and making sure you're billing it appropriately and you're applying the appropriate evaluation and management level service on there. And if your clinicians are confused, they need more clarification, there's a gray areas, this is a great section to go over with them. You can even print the decision tree so that they understand. Not everyone has coders in 2024. Some physicians still actually code for themselves. So it's important that they understand the difference between a new versus established patient and a group practice and how they're billing. So I hope this was super helpful. We always think that everyone understands new versus established patient and is clear as day, right? But sometimes it's not. Sometimes it's a little foggy and we just have to take some time and explain it and just go over the guidelines. So I hope this was helpful. I would love if you will like and subscribe and share the video and leave a comment. Go back and have a discussion with your office staff or your coders or the physicians and let me know what that conversation looked like. Did they understand that about the 3-year rule in this specialty and subspecialty. Did you look at your payer policies? Are they a little different when it comes to specialty and subspecialty? Let me know what you're seeing. I love to chat. So that is staying compliant with KW Advanced Consultant. I hope you guys had an amazing time today learning about it, and see you soon.